What's my role week 4 or week 5 of my patient's radiation therapy to the head and neck for head and neck cancer? So I'm a speech therapist, and 84% of you who watch this channel do not subscribe. So consider subscribing so that we can continue to grow our education content and add guests. So week 4 and 5 of radiation, many things have been impacted at this point in the radiation fields. We are potentially experiencing, and our patients are experiencing, dry mouth and the start of dry mouth, sort of this thicker, ropey secretions as the saliva glands are impacted at this point and do not produce this nice viscous saliva for our patients anymore. Instead, they're starting to produce less and create a ropier sensation in the oral cavity. The other things that can occur around weeks 4 or 5, which is a pretty major side effect depending on the patient, is mucositis. Mucositis are oral sores or sores along the tongue, the hard palate, the cheeks, the soft palate, anything that we can see, even the floor of the mouth, that is potentially going to cause our patients pain or discomfort when they are trying to place food in the mouth. Mucositis at this point in the treatment is best managed medically by the radiation oncologist or the oncologist. Each physician will prescribe a potential medication to help their patients. Some of those medications that we see are often called a swish and swallow or a swish and spit rinse. That medication helps our patients to numb some of that pain and sensory feedback loop that's happening from the response of the radiation so that then our patients can begin to continue eating and drinking. At this point in weeks 4 and 5, it is essential that our patients continue to try to take things by mouth as long as the aspiration is not so great that they are not safely swallowing. Each patient will be handled differently because depending on the initial staging of their tumor and the side effects that their body is experiencing, we as the therapist need to modify their plan. So take each patient one step at a time, allow them the opportunity to begin to expect the changes that are happening, such as mucositis, discuss those side effects with the patient, with the doctor. And at this point, from a swallowing exercise standpoint, you may be eliminating or cutting out some of the many exercises we have prescribed because our patient's body and fatigue is really beginning to kick in. And they don't feel as if they can do all of the things that we as speech therapists want them to do. Work with each patient depending on where they are in their treatment and where their mindset's at. Continue to encourage them and alter their prescription that you have given them for exercises and diet modifications. Sometimes their diet at this point becomes a liquid diet. That's okay, as long as they are working closely with a registered dietitian or their physician to ensure that their caloric and needs are being met from a dietary standpoint and overall health standpoint. So continue to encourage and continue to set clear expectations and goals for your patient.